today I had this client. I think this was their third treatment today. I've been working on neck and shoulder pain, and suddenly they remember that they had a knee surgery years ago.
Happens all the time. For some reason, people don't think that distant scars matter, but of course we know that it can.
Yeah.
Scar tissue just doesn't affect the local site. Contraction and adhesions from that healing process pull through the fascial connections from quads and hammies up into the hips, lower back, and even into shoulders.
Yeah. And even just thinking about that knee itself, we get a really nice, neat scar these days, but that whole area has been literally opened up. So when everything heals, we can have binding into the quad tendon, the IoT band, and especially we expect it around the joint capsule. But those adhesions can then switch off other muscles, the vas medius, even the glute med, way up line. I'm pointing at my back here, throwing the whole chain out. The movement chain gets thrown out, right?
So those muscles stop working or stop activating and firing as they should, which means that other muscles have to pick up the slack. The body creates those compensatory patterns, and that's when you start to see things like the QL, your psoas, the piriformis, hamstrings on the opposite of the leg, even the adductors all start tightening up, trying to create that stability for that person.
And those other muscles working overtime because something in the first place has not switched on. And then we have that pelvis tilt, the hip rotation. I see this so often. People going, I'm rotated in the hip, no one can make it change. We have the spine bracing and even tightening into the diaphragm. Clients don't realize it until we've released something down line that they can take a breath, right?
That's right. Opens it all up. That's right.
Yeah.
What the other thing I also see commonly is, you might have a scar on the knee surgery of the right side, but the client's presenting with pain on the shoulder on the left side.
Yeah, that was my client.
They don't tell you about the knee, so you're treating the shoulder and it just doesn't resolve, and they come back for treatment after treatment after treatment. But until you release that scar tissue and those adhesions, the shoulder pain will keep coming back.
Yeah, and I'm going to tell this story when I train on Sunday because we hound our students on this point. Yes, meet your client where they are, but you can't always trust their history. You've got to delve deeper. You've got to ask about surgical and wound history because an injury decades ago, they think that they're healed and done and dusted, right?
That's exactly that is why we do MSTR and why we're so passionate and so why we nerd out on MSTR. It's such a gentle, precise way to release those adhesions and that scar tissue. And once they're released, fascia's released, muscles can glide again and start firing the way that they're supposed to.
Taking the pressure off the back, restoring that alignment, improving the movement. I feel I can breathe better now just thinking about it.
How often also when you've done a client treatment that those changes are instantaneous. You finish your treatment, the client gets off the table and they're immediately standing straighter, posture's improved and they can move freely again, breathe better straight away.
Yeah, and we got that result today, right? It was so good. And I said to my client, don't you ever underestimate what an old scar can do.
Well, it's the missing piece in someone's pain story, Pete.
Yeah, love what we do.
Changing lives for the